Hi, this is Julie Johnson, and today I'd like to talk with you about qualitative methods. This is part of the HMA 2015 Patient Safety Certificate Program. The focus of this session is to talk about qualitative research. I'm going to define qualitative research for you and talk about why it's relevant for non-researchers, and then I'm going to provide you with an example from my own work. Qualitative research is a process of inquiry into a social or human problem. Typically, you'll work with data that's in the form of words instead of numbers. It's conducted in a natural setting, emphasizing rich description and discovery. It is evaluated subjectively by systematically reducing data to themes and to categories, and the emphasis is on theory development. Quantitative research is also a process of inquiry into social or human problem, but the data is in the form of numbers, and it's analyzed objectively with descriptive and inferential statistics. I know in a lot of your measurement work you're used to working with numbers, but what I'd like to talk with you today is about how to integrate some qualitative methods into your improvement work. Qualitative and quantitative research work well together because it allows a more comprehensive exploration of complex phenomena. Why use qualitative methods? To help you understand the context or the system that is producing the results, to explore how interdependent individuals and groups function or fail to function, and to connect the research to everyday life. Essentially, every number has a story. To illustrate that point, I'd like to go back to an example that we used in one of the presentations on variation. You may recall we talked about infection in one surgical ward. And with the data that were presented, we created an SPC chart to better understand how infection rates looked over time. The SPC chart helped us understand that there were 4 cases of infection in the first quarter of 2011. The mean infection rate was 3.2 per quarter. And the same quarter last year for this ward was 2.8 cases per quarter. The SPC chart helped us understand that we can predict the infection rate for the next quarter as somewhere between 2.2 and 4.2. What do we not know from these data? We don't understand the barriers to improving infection rates. We don't have any ideas about how to change the results. And we know very little about the systems of care that produce these results. Answering these types of questions requires qualitative inquiry. There are several methods that I think are appropriate and very accessible for people who aren't trained qualitative researchers. For example, you can use observations, interviews, focus groups, process analysis, and document or artifact analysis. Observations tell us about what people do, and you collect those data by going into the workplace and observing and taking notes on what people do as they go about their work. Interviews tell us about what people believe, and those are typically conducted on a one-on-one basis. Focus groups allow you to bring together an entire group of people and ask them questions and to use that group dynamic to hear what they believe about the work that they do. And documents can also be included as part of your qualitative analysis. And as you collect the documents, they tell you about the context in which the work is completed. Now I'd like to turn to an example from my own work. So this is from a project on handovers. And our goal was to improve written and verbal handovers in pediatrics with a focus on resident-to-resident handovers during weekends. We had several phases in the project. First, we assembled a work group. Then we conducted some baseline research. We did observations of the process and the content. We conducted interviews with residents and their supervisors. And finally, the research was coupled with a series of 4 workshops with the residents over 3 months to review the data and to demonstrate how to use qualitative methods and process mapping to gain insight into their own handover processes and also to teach them improvement skills. Here is an example of the process map that we developed based on our observations and our interviews. And this shows the process beginning with the residents and the supervisors arriving for the handover. And then the final step was the informal one-to-one handover between the individual residents. Now, what this process analysis allowed us to then look at where there were gaps in the care and where we might think about designing improvements. Here's an example of the data collection sheet that we used to conduct the observations. where we were looking for the barriers, which were the cultural barriers, the communication barriers, environmental barriers, and any other thing that we happened to document. The facilitators, what went well in the process. And then on the right-hand side, you see a column where we kept track of our observations and thoughts while we were conducting the observations. When we finished completing the process map and our observations, we brought those two streams of data together, and we looked at where we could annotate our process map with our observations. For example, if you notice the first box, it talks about the pager going off during the handovers. So in our example from our observation, the pager went off 9 times during one handover. And then with the third step in the process, written handovers per department placed on the table for the receiving residents, we noted that other residents do not get copies of the written handovers. So these were just things that we observed about the process that was in place. Then once we created this document, we could share it with the entire group to help generate ideas for improvement. We also conducted interviews. And again, what we did was to combine those different streams of data, the observations, the process map, and now the interviews, to further annotate our process map. And here are some sample comments from the interviews. Putting it all together allowed us to inform the improvement work. And again, as researchers, we weren't driving the improvement, but we were providing the residents with the information that they needed to design the PDSA cycles or the improvement cycles. Here are some of the themes that emerged based on our interviews, our observations, and our analysis. For our written handovers, we started to think about how we could provide more structure to the process that was already in place. We considered whether we needed to make changes to the current process, and we started to think about how we could ensure legibility of the notes, especially for the weekends, and how we could ensure accuracy of the notes. Some possible improvement ideas that the residents generated were to change the process, to have co-assistants updating the handover, to incorporate a checklist, and to make more use of IT. For our verbal handovers, we talked about how we could provide more structure. Again, we also talked about how we could be more to the point without omitting important information. And we talked about the types of written material that could be used to support a verbal handover. Possible improvement ideas that the residents developed were to create a mental checklist and then to project the written handover on a screen. Themes for improvement continue related to training and sustaining. So how do we ensure that what is learned from the project could be implemented? And how do we ensure that improvements are sustained over time? As new residents come in, how do you train new residents on the process of handover, what information to include, and which patients to select? And then how do you actually provide feedback to the junior residents? Ideas that the team came up with were to implement monthly feedback sessions and to develop training for new residents that would include simulations. This project provides an example of how we used qualitative methods as part of our quality improvement cycle. And this is what I'd like you to consider as you're thinking about how to improve care in your own institutions. We'll have more time to talk about this in September. Thank you.